Well, I'm Dr. TJ Graber. I'm going to be talking a little bit about chronic knee pain. We've had a number of patients come in recently just asking about the different things that we can do for their issues that they have with their chronic knee pain and syndrome. So I'm going to go over a little bit with that today. So I'm part of Full Family Chiropractic. I'm a board certified chiropractic neurologist. What that means is I went on beyond chiropractic school to an extra number of years of studying, and then took a number of boards to get the title of board certified chiropractic neurologist. Makes you a little bit more specialized in the brain, central nervous system, and bodily functions. And we implement that a lot in our care. We don't just go after what the knee condition is specifically with the knee, but also how does that represent issues going on with the brain, or does the brain implement issues going on with the knee. And it can make a really dynamic approach for what we do with knees. Part of our Full Family Chiropractic team, we have over 10 years experience here. We have an acupuncturist that is on staff, Miss Danette. She is wonderful. In our knee protocols, we actually implement acupuncture to really calm down the pain cycles, meridian stresses, and then inflammation. We have a massage therapist on staff along with a personal trainer who can really implement on strengthening and work on the functions of the knee if we need to. We take this from a functional neurological approach, just like what I said. And so we're not just going after the anatomy of the knee, we're going after how the muscles perform, how the brain interacts with your muscles, which muscles are firing, which ones aren't, how your reflexes are. So there's a big dynamic that we do that you're not going to find anywhere else, at least not in our area, that can really help out these knee pain struggles. I'm also part of a forum of doctors across the country. So if I have things that I can't find answers to, or if I come into a wall that I can't get past, I have a whole resource of doctors that I can reach out to, and these doctors are brilliant, and they can really help in trying to understand what direction we need to go to make sure everyone gets the proper care that they need. Chronic knee pain. When we're talking about chronic knee pain, in this particular video, we're not looking at people with knee injuries that occurred in the last 6 months. We do help those, and if you do have a knee injury that occurred in the last 6 months, please don't feel like you can't give us a call. Please do. This video isn't pertaining to that. Okay, this is just for your chronic knee pain sufferers. And this is people who have had the knee pain for over 6 months, even longer, all the way up to 10 years if need be. There's a lot of people that we can help with this, okay? And typically when I have knee pain people come in, we're not looking at, you haven't tried anything else. Like, we're the first people that come in. A lot of our knee pain patients, we're the last resort. You know, they've been to Mayo, or they've been to Sanford, they've been to multiple orthopedics, they've been to chiropractors, they've been to acupuncturists, you know, they've tried physical therapy, and nothing seems to help. That's where we come in, because we're going to take a whole different approach to it. Our acupuncturist and I are going to coordinate with what's going to be the best areas to stimulate with the needles. I'm going to function on a lot of different protocols to make sure you have these cross-cord connections going on along with how the brain is interpreting what's going on with the knee. So there's a big dynamic that we can do. We really want the people who have failed in all areas, all other areas, because we can really help you out. Okay. It doesn't matter if you've had surgery or not surgery. We'll still work on you. You can have bone on bone. We've helped out a number of people with bone on bone, and they still get some relief. Like I said, there's almost always with our patient that come in that neurological component that we're going to address. And one thing that we do here is, if you come in into care and we see you for 2 visits, full on therapy, we're not holding anything back, and you have no improvement whatsoever, I'm not going to take you on for care. You know, unless there's something else going on that you really want us to keep going with it. But if after 2 visits there's no improvement, we're not going to take this any further, because I don't want to waste your time. I don't want to waste your money. I want to know that what we're going to do is going to be helpful, and we're going to get results. And 90% of the time we do. 95% of the time we do. And we know that within 2 visits. And so if you can accept that type of guarantee, you can definitely give us a try. Okay. Let's see here. knee pain conditions that we're looking at. I'm going to run through these kind of quick, and I'm going to have my back turned to you so I can see them, but meniscus tears, we can deal with meniscus tears. Even if there's a tear in the meniscus, sometimes we can create function in that knee to where that meniscus isn't as irritated. And sometimes the meniscus isn't always the issue at hand. MRIs are really good at picking up small details of the knee. So maybe you have an MRI and it shows a torn meniscus. There's a good possibility that I'm walking around with a torn meniscus and I don't even know it. And until I do an MRI, then I find it, and then I have knee surgery done, and that wasn't the issue. Now, I've seen miraculous things occur from meniscus surgeries. Okay, I'm not saying they're not necessarily or bad. Sometimes that's not the issue, but because it shows up on an MRI, they get repaired. So if you've had meniscus issues, sprains, strains to the ligaments or tendons, arthritis in the knee. Just because you have arthritis doesn't mean you're going to have pain every day for the rest of your life. There's a lot we can do for arthritis. We can calm that down, okay? Degeneration in the joint. Inflammation, this is a big factor. Inflammation is the underlying cause for a lot of these things. And that's where we don't necessarily even have to work on the knee itself, which we do, but we'd have to work on the other components driving that inflammation. Maybe it's diet, maybe it's your methylation cycle, maybe you have a genetic component for the inflammation, and we'll address all those. We don't leave any stone unturned here. Like, we go after everything to try and get you the best results that you can. Pez-Ansarine syndrome. A lot of people don't know what that is, but coming around the inside of your knee, you have three muscles. You have your adductor longus, your gracilis, and your sartorius. And it runs down right below the kneecap on the inside part of the knee. That's called your pes-ansarine. It's Latin for the turkey foot, okay, because the three muscles look like a turkey foot. And there's actually a bursa that sits around there. And you can have inflammation of those muscles in that bursa, and we attack that. We try and get that to calm down. A lot of people have issues with that without even knowing. Subluxations, big chiropractic word, right? Subluxation is a misalignment with joint restriction, okay? If you have misalignment in the knee because you have poor muscle tone somewhere, and that joint's not moving as well as what it should, you're going to have inflammation. You're going to have poor joint mechanics, okay? And you eventually lead to degeneration or arthritis or bursitis, all those things. So what we need to do is really assess subluxation ranging all the way from the pelvis to the knee, even in the opposite shoulder. Because if your opposite shoulder and hip aren't functioning correctly, you're not going to walk right. If you're not walking right, that's going to affect that knee. So there's a big dynamic that we take with this. Ligamentous instabilities or tears. Kind of like the sprain strains, but now we're going right into the tears, right? And we can still treat those. We can still get you some relief. Now, if we have a pyramidal posturing, peroneal syndrome, cerebellar degeneration, chronic pain syndrome, fibromyalgia, medications, surgeries, failed or successful, these are all going to be your secondary items, okay? Secondary items are things that we need to address but are causing that knee pain. And if that's the case, we need to figure out why these are occurring, okay? And how that's making your knee pain worse. And we need to get that going, okay? Let's see here. I knew I flew through those kind of quick, but I just want to make sure that we treat a wide range of knees, okay? And there isn't a condition that we're not willing to take a look at. And like I said, even no matter what your condition, we'll take you on for 2 visits. And if you don't have any improvement, you know, we're not going to take you on for a patient. Now, no matter your diagnosis, we've seen it, we've helped it. We take this on as a team approach. We do multiple modalities to rehabilitate the joint, and we attack it from all angles, okay? What do we do different? Okay, this is a big thing that everyone wants to know. We do an intensive 4-part examination. We're going neurologic, orthopedic, muscular balance, and hemisphericity, okay? Big, big words, right? We'll break them down for you. We're going to assess the structure and stability of the joint. Okay, those are going to be your orthopedic exams, figuring out what's going on with the knee and why. We're going to link the brain to the body. This is going to be where your hemisphericity comes in. And I can break this down further. If you have a part of your right hemisphere, okay, of your brain that maybe isn't functioning right, involving your eye movements, okay, that fires down into another area of your brain called your pons medullary reticular formation. Not that you need to remember that, but your PMRF does a lot of things. One of the main things it does is it inhibits your IML, inhibits pain, inhibits the front muscles on the top part of your body and the back muscles on the bottom part of your body. Okay? Now, why is that so important? Well, if this PMRF isn't getting all the innervation it needs from the right hemisphere of your brain, I'm just saying the right side, particularly to the right PMRF, then, and it could be the left, in this example we're just saying right, you're going to have more pain coming in. Okay, that's going to be a big factor for that knee. You're going to have higher blood pressure, you're going to have higher respirations, you're going to have higher sweating because you're not inhibiting that other part of your spine. Next, you're going to have muscular imbalances because you're not inhibiting the back muscles of your leg, which means that these, your hamstrings, your glutes, your piriformis, they're getting tight, and no matter how much you stretch, they get tighter and tighter. And a lot of you know this. Like, you could stretch all day long and it doesn't seem to improve, right? So we need to try and stimulate that to try and calm that down. When these back muscles of your leg start to tighten up, the front muscles of your leg start to shut down. That's just a reflex. They'll actually tighten to keep you from dislocating your hip, but then they weaken, okay? And I know how to figure that out. And we've done it 100 times here. And it involves a very extensive neurological exam. We're testing posture, balance, reflexes, muscle strength, sensation, making sure everything is working well in the certain areas. Once we find the areas that they're not, then we start to work on those. Okay, then we start diving into eye exercises to stimulate the brain to help control some of these muscle balances. It's pretty amazing once you start seeing the results, and people are really surprised with what we do. Assessing long diameter afferents. Okay, these are LDAs. So these are taking nerve impulses from your knee up to your brain. These are very important because what happens is they project from, let's say, from your big toe all the way up into lamina number 2 of your spinal cord. Lamina number 2 is called your substantia gelatinosa. Now that's very important because that has interneurons that fire in and inhibit pain. Notice the big concept here. We're trying to inhibit pain and improve function. And a lot of times, the long diameter afferents in your leg are not nearly as sensitive as in the upper body, and they should be because they are fast firing nerves. We need to get those things to fire off. And we can, and a lot of people see a difference, like I said, within a few visits once we start stimulating those long diameter afferent nerves. Okay? Muscular testing. We do a lot of muscle testing just to figure out where the muscle imbalance is. Okay, 4 main muscles that we go after with that knee: quadricep, iliopsoas, iliotibial band, and your popliteus muscle. Okay, we test others, okay, but those are your 4 main ones. Iliopsoas doesn't actually cross the knee, but it's very intimate with your quadriceps, okay, and that can help control function in that knee. So we make sure that we test, make sure iliopsoas is firing off, quadricep, iliotibial band, and popliteus. We do check hamstrings and other things like that when we're not getting the response we want, because once in a great while your hamstrings can weaken. Now, most of the time our hamstrings and the back muscles of our legs are very strong and our brain's trying to shut them down. Okay, we hardly ever have to actually start to therapy the hamstring unless there's been an injury there. With this, every now and then we will assess that if we need to, and that's what I'm trained to know. Acupuncture examination. I can't elaborate on the acupuncture examination. That's where our Danette, our acupuncture specialist, comes in. She has a master's in acupuncture. She went to school for a number of years to get that. We're very proud of her. She does a phenomenal job. And she would be the person to talk to about the acupuncture examination, but we do include that because we want to make sure you get the best care you can. All right, how do we treat? Nerve assessment. Okay, we go right after these nerves. Nerves need 3 things to survive. They need oxygen, they need stimulation, and they need glucose. Okay, so we make sure you're getting enough oxygen, you make sure that you're getting enough stimulation. Glucose usually isn't a big issue. So once we start getting these to fire off, those long diameter afferents start to fire off. Okay, just like what I said, they decrease pain. Go to lamina 2 spinal cord, interneuron, and they start to shut those pain fibers down. Okay, we do exercise with oxygen therapy. That starts to bump up your oxygen in your system so that these nerves can do what they're supposed to do and your brain can do what it's supposed to do. We'll do electrical stimulation. Reduces pain, releases endorphins, improves circulation. Circulation is going to be a big factor with everything that we do. You're going to see that a lot. We do laser therapy. Reduces pain, improves mitochondrial protein production, early gene expression, improves circulation. That's very dynamic in what we do. We want to make sure that we start to get the cells what they need to do to rehabilitate themselves at the level of the mitochondria, which is the powerhouse of the cell. PEMF, which is a resonating magnetic field, again, improves circulation. It actually, under a microscope, before a PEMF, a pulse electronic magnetic field, is distributed, shows the red blood cells kind of coagulating together as they're going through your arteries. And after the PEMF, they are free-flowing and blood is flowing better. That's where this improved circulation really comes in. Cellular regenerations. Vibrotherapy, okay? We get a lot of relief from this. We stimulate the muscles with vibration as we do different exercises. And it works beautiful to try and get muscle balance back to the knee. A lot of people say that they get the most relief from that exercise more than any of these other ones. These other ones are very important and they do very well. People feel the best with that, okay? This is where we balance weak muscles, we stimulate LDAs, and we improve circulation. Watch. Improve circulation, improve circulation, improve circulation, improve circulation. Big factor here. We need to get the inflammation out of that knee and start getting it to heal. Alright, what else do we do? Chiropractic adjustments. We improve the movement of the knee. If the knee is moving better, the joint's going to move better, inflammation is going to reduce. Balance. Stimulate mechanoreceptors. So inside the joint there are receptors that pick up the mechanics of the knee as it moves. And as your knee gets twisted or out of alignment, you're not stimulating those same mechanoreceptors, you start stimulating those pain fibers. If we can restore that alignment how it needs to, you actually start to stimulate the cluster of mechanoreceptors in the joint. That fires up again into lamina 2 and reduces pain. So it's very important that that knee is structurally sound and in the correct position as it needs to. We do coordinating exercise. The big thing about this, cross-cord stimulation and reflexive movements, all linked to your gait pattern. Gait pattern is how you walk. We want to make sure that you're walking well, and we start stimulating the same muscles that stimulate when we start working on the knee that we need to restore function to that knee. So we'll do cross-cord coordinated movements. Eye movements, we're stimulating the brain now, okay? We're trying to do muscular balance, flexor relaxation. That's what I'm talking about, those muscles on the back part of the leg, muscles on the front part of the leg. Okay, we need to use the brain, stimulate your cortical brain, your smart brain, where we do all of our thinking, goes down into our brain stem and starts to reduce that flexor tone, okay? Balance and coordination, then acupuncture. Again, acupuncture, we're going to stimulate LDAs, improve circulation, balance, meridian interference. Okay, and Danette will be able to explain that in a lot more detail than what I can. I know my limitations. All right. When we do this, when we do a knee package, this is we don't leave anything behind. We include all of this. Okay, chiropractic treatment, acupuncture, nutrition, vibrotherapy, laser, electric stimulation, PEMF, exercise with oxygen therapy, central neural rehabilitation, coordinated exercise therapy, cross-cord reflexive training, balance training. Nowhere is this type of package offered. Nowhere. You're not going to find this anywhere. There's nowhere where people are linking all these things together in one package. And I ask if someone does find a package like this in our area or even in a 200-mile radius, please let me know. Because I'll gladly call up that doc, and if he's closer, go see him. And I'll make sure you're getting the proper care there. Okay? This is why we see improvement in 2 visits. This combination. This is how fast this can occur. Okay? If we don't see improvement in 2 visits, we will not take you on as a patient. Guarantee. Okay? No ifs, ands, or buts about it. If we're not seeing it, we're not going to take you on. Okay? What's the catch? Okay? $150. So this is going to include the initial exam, me figuring out what's going on with you, why your knee is acting the way it does, and what we need to do to try and help it. It's going to include 2 sessions of therapy. The therapy sessions do not include acupuncture. So we won't include that. right away, because we want to make sure that we want you as a patient, number one, and number two, it's difficult to coordinate all of our scheduling with Danette. So that's one thing that the 2 sessions of therapy is only what I do, okay? Doesn't include the acupuncture. This is a billed cost of $950. If we were to send this off to whatever insurance company, the initial examination, 2 sessions of therapy would go that insurance company at $950. We're selling it for $150, okay? So, with that being said, you can come in, you're going to do your initial exam and 2 sessions of therapy, and it's $150, and if we don't take you on as a patient because we're not getting improvement, or you decide that you don't want to be a patient because it's too much, or too extreme, or for whatever reason, you're out $150 and some time. That's what we have. We don't want people not to come in because they're afraid of how much the 2 sessions of therapy is going to cost. All right. We want only people that are committed, okay? Because this is going to involve lifestyle changes. We need to reduce inflammation, okay? This is going to include some purchasing of supplements, because if people come in with chronic knee pain, we need to give your body the best resources as it can to heal that. And if you're not ready to purchase a few supplements to start to support that, I'm not sure if this is a program for you. What we do here involves some at-home exercises also, and this is not easy and it's not for everybody. Now, you're not going to be sitting here doing rehab at home for 2 hours every day, but you will have to do some exercises to stimulate your brain and stimulate some of these muscles that we're working on, okay? And that's going to take some work at home. And if you're not ready for that, I don't want you in here. And that's okay. I'm not trying to be mean, or I don't look down on anybody. Some people, one, you're just not in enough pain, okay? Or 2, you're pretty comfortable with where you're at and you're not ready for those changes. And that's your decision. That's your body. You can decide whatever you want. When you are ready, give us a call. We'll do what we can to try and help you out, okay? What's this going to cost? Every program is going to be a little bit different. If you can afford approximately $100 a month, you can afford our program, okay? We do have financing available, and you can ask us about that when we get through our 2 visits, and we'll see where we're at and what we can do to try and help you out. If you feel like you can't afford our program, that's okay too. We'll try and do everything possible we can to make this work. And if it doesn't work, it doesn't work. And at that point in time, we'll try and make the best options available. Okay? Chronic knee pain relief program. That's what we're talking about. Ready for knee pain relief, give us a call. If you're ready for some lifestyle changes, even regardless of the knee pain, to help you, this is going to be it, because we're going to give you tons of tools and information just to help your overall health. 507-425-0025. That's the number to our clinic. 507-425-0025. Okay? Again, I'm Dr. TJ Graber. I'm at Fulda Family Chiropractic, 108 North St. Paul Avenue in Fulda. 507-425-0025. Mention the knee pain relief video, and we'll give you $25 off that initial exam fee. Thank you guys very much, and I hope you have a fantastic day.